Today on the podcast, we are welcoming Dr. Emily Petroline, a clinical support and functional medicine pharmacist with 15 plus years of experience, who is starting, very exciting, her private practice in Edwardsville, Illinois. We'll get to learn about Dr. Emily and her new private practice in this episode. Stick around.
Welcome to the CrossFit Edwardsville Community Podcast, where we hear and learn from our coaches, CrossFitters, and Glen Ed community leaders. Now, here are your hosts, Dallas and Greg.
What is up, everybody? Welcome to the CrossFit Edwardsville Community Podcast. So glad to have you here. We do get to meet and learn from our CFE coaches, learn a little bit more about some of our local CFE CrossFitters, but occasionally chat with those locally owned Glen Ed business owners and some of the characters behind them, which is what we do get to do today. I'm very excited. I'm your co-host, Dallas Amston, your Communicate to Succeed coach. And with me, as always, the very one and only G Scale. What's up, brother?
What's up, man? Yep, guys, Coach G here, co-host the podcast, but it's not about me today. It's all about Dr. Emily Petroline. As mentioned in the intro role, she's a clinical support and functional medicine pharmacist with 15 plus years of experience. We're excited to welcome her private practice to Edwardsville, Illinois. Everybody, welcome Dr. Emily Petroline. Emily, welcome.
Hi, thank you. I'm excited / very nervous to be on my very first podcast, but I'm open to your questions, and I want you to get to know me and how I can serve our community.
Well, awesome. By way of doing a little bit more introduction for our audience, Dr. Petroline has always had a passion for whole health, lifestyle optimization, and she believes that if you take the time with patients, you can find ways to prevent disease before it happens and dig deep to find answers to their health concerns. She wants to help patients change their perspective on health with a focus on rest, stress management, activity, and nutrition, not just pharmacology. Her clinical interests also include nutritional deficiencies, adrenal function, metabolic health, and gut health, and we'll probably touch on some of those topics in the podcast today. Her background also, she got her Doctor of Pharmacy from the University of Health Sciences and Pharmacy, formerly the St. Louis College of Pharmacy, STLCOP. She has also served as a pharmacist with the Farm to Table team, as well as the John Cochran VA Hospital in St. Louis, which, as a side note to that, it is very possible that you have worked with my mom, who also worked at the John Cochran VA clinic in St. Louis.
Oh, possibly, yes. Been there many years.
I think what we've just established from just that intro alone, Emily, is that you're way smarter than I am. And I love the conversation purely from the point of view of what I'm going to learn. So today on the podcast, everybody, we do get to learn. We get to learn directly about functional medicine, how it's different than some of the traditional approaches you're aware of, and how it can really help us overcome some of those challenges, especially here in the new year, associated with our current healthcare system. So, Dr. Emily, just easy question to get you started. Are you excited? Are you ready?
Yes, I'm very excited. I actually could probably talk about this all day long because it's my passion and my dream. And I pretty much from day one of coming out of pharmacy school was like, oh, I want to make people better, not just kind of give them another Band-Aid.
Awesome. Well, let's get started with an easy question then. I mean, maybe it's not easy. Maybe this is one of the big ones right out the gate. What is functional medicine?
And that is kind of a hard question because functional medicine is complex. We take a very patient-centered approach. The normal approach is sometimes just like a quick 15-minute appointment, and we take a long appointment. We start with day one. To kind of backpedal a little bit, functional medicine is asking the whys instead of, okay, you're diagnosed with disease A, let's treat you with the B medicine. This is like, why did you come upon this disease? Is there something that we can investigate more to keep this from progressing or to help possibly reverse?
It sounds like, and you can let me know if I'm hearing this correctly, that with traditional medicine, there's a heavy emphasis or dependency on pharmacology versus getting to the root of the problem and addressing it from the root. Is that safe to say?
That is very safe to say. Very correct. Yes.
All right. I mean, how else would you characterize the difference between the functional medicine and traditional medicine?
Well, like again, I said, it's the appointment basis. So if you have symptoms, you're going to go to your conventional, traditional doctor, give them your symptoms. They're going to run some labs, and you might get a diagnosis and then get a treatment. With us, as we start from day one of your birth, there are some caveats to know, like, whether you were cesarean or were you a vaginal birth, and all throughout your childhood, what were you exposed to, if there was any trauma in your life, and then we can go through all the pillars of, how are you sleeping? What is your nutrition? Are you moving? Kind of your faith practices. Do you have any community that surrounds you? And then we get into like more of the medical side, is like, what medications do you take? What diagnoses do you have?
That's awesome. So go ahead, G.
I was going to say, with this, would you say that the approach is more preventative necessarily versus, trying to put out a fire once it started?
Yeah, we would want to be more preventative. That's our goal. Is to everybody change their mindset of changing the lifestyle, to preventing our disease states. But the state that our country is in, or our world is in, is, we have probably, I think it's definitely over 50% of our country, people are on at least one prescription medication.
Yeah.
My patient population that I deal with on a daily basis are on probably 5+ medications and multiple disease states. So as a functional medicine provider now, we're kind of having to dig in what's going on, finding the why, and getting our patients into a mindset of, okay, how can we maybe reverse this a little bit or keep it from progressing?
Yeah. So, total random. Are you familiar with the root cause connection and Dr. Michael Foreman?
No, I'm actually not.
This reminds me a lot of what I've heard Dr. Foreman say about that kind of stuff too. So I guess my question for you then, Emily, on this is, what attracted you to this approach? Like, in the first place, can you share with us a little bit of, I guess, what would we call it, G, your functional medicine origin story?
I've always been in love with like the nutrition aspect of the creativity with it, what you can do with like real food. You've heard over time and time, food is medicine.
Yeah.
We're actually having some large organizations starting to adopt that. You're going to start seeing programs roll out, like from the American Heart Association, that we really need to start focusing on that.
Yeah.
Not only does nutrition have a big play, but, as you both probably know, that movement has a big play, rest, stress relief, of how we can help our bodies heal and maybe prevent some of that disease progression. Myself, I was seeing patients. I mean, I have a lot of patients that are on 20+ medications.
Oh my Lord.
And I don't see that changing right now. So I wanted to take a step to where that I could start practicing, to where I could start getting patients off medications, or help them prevent them from starting more medications, or start the very beginning of patients to recognize that disease is a possibility on the lifestyle that they have.
Yeah, we've seen for us that the standard American diet is a big part of the problem and a genesis. A lot of the unwellness, a lot of the sickness on the continuum, and getting healthy eating right is a big part of the solution as well. Well, it sounds like you're kind of integrating these things into like a holistic approach, where it's not just back-end pharmacology, it's systematically getting a person back to a state of wellness where they're not dependent on the medications in the first place, is what it sounds like.
Correct. I'm still a big believer that where the state of most of our patients are in, they need that medication. It's just another tool. But we need to give them all the tools in the toolbox. Like, give them a meal plan, give them motivation, ideas on how to do stress relief, ways to start moving their body. And then also education, just educating our patients, giving that free to them in our healthcare is valuable.
I think education is huge. I mean, I was just having a conversation with someone recently who specifically was talking about the pie they were eating and how it was okay because it was gluten-free. I was like, that's not the definition. And that their doctor had told them to quit eating as many carbs, and so they were like, so I'm really cutting down on my vegetables and all the starches, and I'm like, no, that's not how that works either. So I think education, and one of the things, I mean, we have such a glut of information when it comes to nutrition, health, wellness, diet, exercise, keto, paleo, carnivore, low carb, Mediterranean. It can be so confusing, and unless you have someone guiding you through that jungle of misinformation, it can be really difficult.
Yes, and our team is strictly evidence-based. We also take everybody's beliefs in account.
Sure.
If they've been practicing something that we don't see as harmful, then we're not going to tell them to quit practicing it.
Sure.
You mentioned ketogenic diet and paleo, things like those have been studied, and we just don't have the evidence in most of the general population to recommend it, that we can say, if you're doing this and it is working for you, then we want you to continue doing it. Sure. So that's how we approach most things, is just making those steps to creating a healthier lifestyle.
Yeah. I would definitely say you probably have the evidence, though, that the food pyramid perpetuated by big cereal probably isn't the most healthy thing.
Yeah, there's no food pyramid on our recommendations now.
Yeah, sure.
Oh, phew. All right. It makes me feel considerably better in my heart and my soul.
Gee, we got a good guest then.
We have a good guest.
No.
Hey, I want to do a shout out to Dr. Bradley Poland, who actually introduced to me to Emily here. He also was the one that let me know that you're starting your own private practice here in Edwardsville. Is that correct, Emily?
Correct. I'm not a brick and mortar, so you can't come see me in a place, but I am here virtually for you. If anybody would ever want to meet me in person, I would have no objection to that. My goal one day is to maybe open up a place in Edwardsville. I would really enjoy that. I want to serve our community.
Cool. So is this your first business? Like, kind of give us the picture, your background as an entrepreneur, or is this your first foray into having your own business?
Yes, this is my first time delving and finding my own clients. My own patients. Yes, I would say this is my first business. I've pretty much been just practicing at the VA for the past 15 years, but learning everything I can learn there. And then I met this great farm to table group, very supportive. We kind of all each work individually, but we work together as a team of sharing knowledge. We have functional medicine CE programs that we invite the whole nation to attend. We do wellness reset guides a couple times a year that we invite the nation to. There's quite a bit of things that our team does for the whole nation.
Can you tell us a little bit more about that? Because it seems like the farm to table, and which, by the way, to our audience who's just listening at home, that's PHARM, farm to table. Can you tell us more about that? Because it seems like it's a really important part of what you do. And it's maybe even been part of the impetus behind you starting your own practice.
Yes. So I joined the group this past September. It is a group of pharmacists, quite a few of us. There's 20 plus pharmacists on the group all over the nation. Since we are all licensed in different states, I'm licensed in Missouri and Illinois, so I can see Illinois patients and Missouri patients. But if you have loved ones or friends or family that are listening in Texas or listening in Ohio, we have pharmacists there too. So through the farm to table, we practice functional medicine. We ask a patient to look and see what would fit with them if they feel like our services would be beneficial to them. We do a whole year. That's a kind of like, not group, but I'm trying to think of the word. We do like individual consults, but then we also do like packages to where you could package. We have health coach, we have nutrition coaching, And we also have like lab services too, if you would feel like that's appropriate for you.
Gotcha.
Yeah, we also have I was going to say real quick, we also have a podcast as well too, something that should be looked at, and that you can find that on our farmtotable.life website as well.
I saw that. Shout out to the Table Talk team,
Yes.
I believe.
Yes, Table Talk.
Well, let's bring it back to Dr. Emily Petroline here. So for you, what is the mission of your new practice? The mission statement, the vision statement, the core purpose? Like, help us understand that higher vision for what you do.
I love to help anybody that feels like our services would help them. But mostly I'm looking at more complex cases to where a patient, like for example, a patient would be put on medication after medication after medication. They just don't have the answers and they don't have the knowledge of how to help themselves. I would really like to help those patients. And I'm even willing, I mean, that's what my job is too, is also talk to their doctors, make recommendations, kind of create a team to help a patient get better instead of continue to have questions and continue to be started on other medications.
That's awesome. So you kind of described that ideal client there just a little bit as male, female. Does any of that matter in your role?
I would say I feel like we're inclined to see more females. We see more hormone issues. We can all agree that as time goes on, we're getting more stressful. As a mom, as a wife, as an entrepreneur, as an employee, I'm very stressful. I have stressed moments that can have a big impact on your physical health.
Yeah.
You both probably heard of cortisol.
Yep.
If you have chronic cortisol release, then after a while, then you might actually become deficient in cortisol.
Yeah.
It's good to have a good acute stress response sometimes, if you need to save a life or if you need to get a task done. But if you're chronically stressed over time, then you could start seeing your hormones plummet, your good sex hormones. You could start seeing problems with your sleep, problems with weight. And then it's also been linked to, your disease states of cardiovascular risk, diabetes risk.
Yeah.
I would say I'm leaning more towards the women's side. And also I am a woman, so I just kind of can feel for them, empathetic, I would say. And then also like with age range too, the older we get, the more disease we see progress. So also I'm looking for more of the adult, older population.
Awesome. So when one of those ideal clients come through, the older female population, again, that's ideal, but we know you can work with everybody. When that person comes through and they want to get started, they start having that conversation with you. What does that first visit with you look like?
So what I would recommend normally is like the first initial consult. It's around an hour. We take patients, or we put a questionnaire out there that they fill ahead of time, starting from birth all the way to current state. We ask for their disease states, for their medications, how they were born. We talk about nutrition, sleep. We talk about their stressors in their life. We go through quite a complex, we call it a mapping system. From that mapping system, I could also maybe have their preliminary labs from their past provider. And I could start making recommendations then. We set goals. Okay. That way at follow-up, we can see where we're at on goals. So some patients, for example, might be that they just don't want to feel tired anymore. So we would set up a plan based on labs, based on their questionnaire. We could possibly be supplementing. We could possibly be actually treating something like thyroid disorder or anemia. Or maybe there's a chronic viral infection that's going on that we could test for. But it's kind of it's like a hide and seek kind of thing. Like we have to go find it first and see if that was the trigger. Yeah. And that's what functional medicine is, why it's a little bit more complex.
For sure.
I can see why, doing a truly thorough investigation of a person's health history to identify what all of the causes are would take a while. I know that like for us on our end, like when I'm talking to somebody brand new to our CrossFit community, I'm usually talking to them like 45 minutes because it takes that time to really learn about a person and get to know them and know like what makes them tick, what have been the problems in the past, what are other potential undiscovered problems that might be contributing to the challenges they have. So we now have a clearer picture of like what that day one looks like with Dr. Emily. Then what should somebody expect in the following months of their partnership with you? Like, where does it go from there?
Gosh, it could go anywhere, honestly. It depends on the patient, really. Normally, we try to follow up within the next 3 months. Well, after you create a plan for them, normally I'd be like, okay, maybe we need to do some unconventional lab testing. We do gut health testing. If we notice that there's been a lot of complaints in the gut area, or we notice that there's a lot of disease states on that have been linked to poor gut health. So we would maybe get those labs drawn and then give them a plan for that. And then in 3 months, 4 months, see where they're at with those recommendations. There's a lot of disease states caught in there, like, small intestinal bacterial overgrowth, maybe some like H. pylori, things that you might find in a patient that if you can resolve those issues, then they might have a better life.
Got it. So just a question for you as the entrepreneur then, kind of getting away from practice and what you, because we don't want you to give away all the secrets and have someone go start Googling away and think they can do it themselves. I mean, again,
I don't want to give away any secrets, and I don't
don't give away the intellectual property.
Please don't use Google.
We know though, and in our community, especially the community that listens to this and at CFE, we know that coaching and accountability is one of the most crucial factors for breakthrough in your life. And so we don't have a real DIY focused crew here, a real do-it-yourself focused community, because we all know that it takes a team of people helping us live our best lives. So getting back to you though, Emily, as the entrepreneur, we know this is your first business, but we know you've had a story leading up to this. How has failure or apparent failure set you up for success in your life? Or if we can say it like this, the way G and I like to say it is, what's your favorite failure?
Well, when I first think of this question, I think, okay, why didn't I do this sooner? I probably could have been practicing this so much longer and have so much more knowledge behind it to better serve others right now. So that's the biggest thing that sticks out in my head. I would say my biggest failures is my own health failures. We all do it. We all start eating crappy. We all start not getting the rest we need, or, okay, I've missed quite a few days of going for a walk or working out. And then you reevaluate, like, okay, I don't feel the best anymore. What was I doing when I was feeling well? So I think, those are my favorite failures of reflecting on those times that reflecting on the times that I was doing good things to better help my body. And then like, oh, I need to do those things again. Just kind of coming back to it.
Yeah.
We're all a work in progress. I know that like for me, coaching others helps give me a degree of accountability to lead by example and live that lifestyle myself too. So let's now look at the flip side of the coin, right? The best part of your work, Emily, if there's something you'd love to experience every day, what is it? What's awesome about being you, the pharmacist?
When I see the patient have a light bulb moment, that's for sure. When they say, oh, like, okay, maybe all these medications aren't going to get me to feeling my tip-top shape. Normally the biggest thing is when patients realize that stress could be causing their disease or be a part of their disease. We all are living in a stressful environment. And it is our job your own job to de-stress, to figure out how to way to make yourself rest.
Yeah.
Once you see that can heal you, I really get excited for patients when they see that.
So do you do house calls where you go and you look in their environment and go, hey, this is cluttered, this is messy, your cabinets are full of crap. You need because environmental wellness is one of those dimensions of wellness,
No, but I need a partner with that person, because I would,
right?
yeah, there needs to be that kind of job out there.
The person who goes in and just is like, hey, your environment is set up it's like a cortisol rich environment.
Right.
Listen, we need you to declutter your kids because they are stressing you out right now. So
That's funny.
That will begin tomorrow when they go back to school.
Oh, tell me about it. I'm so they're one door away right now, Emily, and I can't wait for them to be back in class. For those of you wondering when we recorded this, you just got your answer right at the end of winter school break.
Mm-hmm.
So Emily, then those moments, what would you say? All right, so we talked about your failure. We talked about what you'd love to experience every day. What would be the one thing in your business or your work that if you could make it go away forever? If I could never had to deal with this again, I would do it.
Oh, in my business?
Yeah.
Or okay.
Well, yeah, no, you can get as open as you want with us here. Nobody's listening.
Man, that's a hard question. Because I'm very new to the business part of it.
Sure.
If I could be really honest, if social media could go away, I know most entrepreneurs are like, no, that's how I make my money. But I'm like, it is so frightening to be on social media, honestly. So business-wise. For my practice-wise, I would say the apprehension or I'm trying to think of the word. Yeah, apprehension of patients like not wanting to step into that space because they're afraid of change. If that could go away in their minds, that would be great. Just taking that leap of faith, finding somebody you trust to help with you.
Yeah,
that's something that we encounter too here in our CrossFit world. Like, we have a reputation for being extremely extreme, and it can make it like really scary for people to step into our doors. Because like a lot of people, they know somebody who does CrossFit and it's just like the CrossFit evangelist, and like, it's so awesome, you have to do this, it's amazing. And you're like, I'm pretty sure that person is crazy. I don't know if I would fit in with that crowd. You know what I mean? So like, we kind of deal with some of that apprehension also. What is wonderful for people is when they actually come in, they realize quickly how non-judgmental, how open and accepting, and how like, honestly, like intelligently the program is designed. It's not just a bunch of foolhardy 20-year-olds who are putting themselves in harm's way constantly. So we kind of encounter that also in our world. Yeah. And it's a belief shift, which is a really important thing. I think for anybody's transformation is changing their belief system. Mm-hmm. And speaking of, for Emily, in the last 5 years, what new belief or behavior or habit has most transformed your life?
Oh, my faith is a big one, I would say, of believing that I was created to love on others, to be creative. I would say that would be a biggest one for me. And then my behaviors, I would say in the habits of just soaking up as much knowledge as I can from providers, from professionals that I hold on a high esteem too. Looking for that. I also looking at the pillars of your life, of resting and a good nutrition and moving my body, and just giving myself a lot of grace too. That as well. I would say that's what I've been, focusing on these past 5 years, I would say. Yeah.
That's good. So as far as shifting beliefs and behaviors and some of our habits, like I mentioned earlier here at CFE, we're big on trainers, accountability, mentors and learning. So which mentors have been most influential on you, both personally and maybe in business as well? I mean, have you had a coach that you've worked with on the business side, or someone that you've got some key learnings from personally as well?
Oh, for sure. To stop, right off the bat is Melody Hartzler, who's the owner of Farm to Table. She would be one of our big mentors, my big mentors. She's the one that has encouraged me to join. She is the brains behind it all.
Okay.
For sure. I would also say at the beginning when I started researching Farm to Table, you probably know the name Mark Hyman. He's like one of the big guys of functional medicine.
Dr. Hyman.
Yeah, Dr. Mark Hyman. I started to listen to some of his podcasts. Podcasts were a big thing to me at the beginning of my journey with functional medicine, of listening to them. Some of the unconventional lab companies like Genova Diagnostics, they would start doing podcasts and to get into the science part of it. And I was always asking questions, why? So yeah, I would say those are more of like, the national known mentors, I would say. And then personally, my husband has always had the entrepreneurial mindset, and he's the one that has motivated me, encouraged me, come alongside.
Nice. I love that.
Yeah.
Love that.
Yeah.
Do a quick shout out, Emily. Do a shout out to your husband, your kids.
Oh, yes. My husband, Andrew Petroline. He works with Utilitra, with IT and cameras, things like that. And I have my great, almost 12-year-old here in about 8 more days. Charlie will be 12. He goes to Liberty right now, middle school. And Alexandra, she goes to Columbus. My little girl, she's awesome as well. So, yeah, love my family.
Love it.
Shout out to the family on here. What about, so we've talked about like beliefs that have formed you. We talked about mentors that have formed you. Like, what about books? Like books that really like inspire or drive you, or have like, were the thing that kind of pushed you into becoming an entrepreneur, starting your own practice? What books have been really influential on you, personally or professionally?
Oh, gosh. I do not have a very good recall mind. So I would not be able to tell you the books and the authors. I could probably share that in the comments later. What was her name that did like the Whole 30?
Melissa Hartwig.
Yeah, that was one of my first books like 10 years ago that I read on like, oh, maybe like taking certain foods out of your diet might be causing inflammation. So that was like my first like eye-opening experience, I would say, with that book. But off the top of my head, I can't think of any other books, honestly.
It's all right.
Yep.
So kind of a more funny or fun question. What is an unusual habit or an absurd thing that you just love?
Oh, gosh. Well, we've already mentioned this. We talked about like having stress, and sometimes clutter causes stress. And so I'm notorious for throwing, this is per my husband, by the way, always throwing things out without everybody's knowledge.
Well, you and my wife, Caroline, you would have some things to talk about. You guys would get along great.
Like,
2 weeks ago, I said to my wife, hey, where's that thing? And she goes, I threw that out a few weeks ago. I'm like, no, that was one of the few things I used around the house. She was like, sorry, it looked like it was taking up space 2 weeks ago.
Yeah, so maybe it's pretty more common than we think. Maybe this is not unusual.
For a while, I swear this is absolutely true. For a while, I say for a period of like 3 weeks, I swear, every day that I came home, where the recycle containers were was a different location every day. Every day, Emily, every day. I come home and like, it was just, where is it now? Oh, it's behind the trash can now. Oh, it's in the closet now. Okay, it's by the front door now. I was like, Caroline gets on these kicks where she just like redesigns our whole home environment. The couch is in a new place, like the TV's in a new place. So Yeah, you guys would get along just fine, I think. She is all about the decluttering life. All about it, Emily.
It's form of stress management. That's what I call it.
Sure.
Yes.
So Emily, what are you talk about your business? Like one last question on that. What are you most proud of in your business that you have done so far as a pharmacist?
I most proud that I still care. That I haven't gotten to the burnout part. I see all too often, I mean, pharmacists, healthcare providers and pharmacists are leaving the industry, trying to either find something else in the industry that's not patient care or just getting out completely. We all had the burnout during COVID, and we continue to do because there's so many more disease states, so many questions that patients are still having that we don't have the answers to yet. So I would say that I'm most proud that I continue to care for them. I still want patients to heal. And that's why I took a step to do it in a different way.
This is really interesting to me because like what you just described, Emily, is my brother Anthony's story. So just by way of setting a context for this, like pretty much everybody in my family works in healthcare in some regard. Like I got my doctorate in physical therapy from WashU. My brother Anthony got his pharmaceutical degree from the University of Illinois in Chicago and was a retail pharmacist. Early last year, he hit that complete and total burnout stage and quit everything. Straight up, just quit his job, quit everything. Put some clothes in some Millennium bars, some stack bars in his backpack. Went down to the southern border and walked the entire Pacific Crest Trail from Mexico up to Canada over the space of about 6 months because he just couldn't do it anymore. And he has recently returned to civilization and recently been reintroduced. But it is for him been a very difficult reintroduction because I mean, what he sees in retail pharmacy is a lot of the people who they're not interested in fixing their diet. They're not interested in learning alternative ways of managing their stress. They just want the medication and more of it. And for him, it's very frustrating because, it's this whole mindset, you know what I mean? Mm-hmm. And it sounds like hopefully you can attract more of the people that are interested in not just beating down the illness with a medication, but also doing other things to create a overall healthier, happier, complete life. You know what I mean? That has to be for you much more rewarding, much more fulfilling than just doling out scripts all day. You know what I mean?
Yeah. It's seeing the end product. As a pharmacist, you don't really see the end product very often. You just see the in between. And probably 9 out of 10 times the end product of the medication that was prescribed is probably another medication a couple of more years down the road.
Sure.
I have to say, when I went to pharmacy school, we had like non-pharmacological tidbits in each disease state that would be like 2 lines in the book, the textbook. And then we would go on to talk about pharmacology for chapters and chapters and chapters. Like, if we could focus on like the majority of it being non-pharmacological interventions, I think our country, our nation, our world might be on a better, have a healthier life, honestly.
Yeah.
It's where we put our focus at.
That's good. Well, so apart from just thing you're most proud of in your business, what's something personally that you're most proud of in your life?
Let's see, personally proud of. I would say my contentment. I would have to say I'm personally proud of that.
That's awesome.
Trying just to be content wherever I am, trying to just be where I'm at. I'm proud of that.
Good.
That is a skill. That is definitely a skill. The skill of contentment, the skill of learning to be at peace with what is, while also balancing that desire to continue to grow and evolve and improve and advance that we all have as humans. You know what I mean?
Oh, yes.
So now, Emily, as you look ahead in life, what most excites you about the future? What are you most looking forward to?
Personally, I most look forward to traveling. Our family, well, my husband and I love to travel. Our kids are in that middle school age right now where they don't understand what mom and dad are talking about. And I hope we can really embrace that into their lives. But we take them with us. We do get away on our own too, but I'm mostly excited about all the new places to see. How awesome is that we live in a time to where we can jump on a plane and go anywhere and learn different cultures and see some amazing stuff.
Love it.
Cool. Well, I'll tell you what, we've kept you for quite a while here, Emily. It's been awesome to talk to you.
No,
how can people find out more about you or about your private practice if they want to? Where should they go?
Definitely go to farmtotable.life. That is our general website. There you can say, meet our providers, and you'll find me in that list of providers. I am the Illinois pharmacist. There's 2 of us in Illinois, 1 more in the Chicago area, and then myself here more in central Illinois. And then I also do take Missouri patients too, because I'm licensed in Missouri. But like I said, again, if you have friends, loved ones that are in different states, choose that state. It's like, oh, I know my mom is on, so many medications. This sounds perfect for her. Just, find me on there. That would be great. I would definitely say reach out and do a discovery class. Listen to our podcast on Table Talk. And then I'm always up for like a 15-minute free consultation first to see if we're a right fit for you.
Got it. And you guys can learn more about that at farmtotable.life. You can also learn more about Dr. Emily on Facebook and Instagram at Farm to Table Team. That is PHARM, Farm to Table Team. Emily, it's been amazing having you on the podcast. Thank you for taking all this time to teach us more about functional medicine, help us better understand what you do and how it can help us to live our best lives.
No, I'm so grateful that you invited me to showcase what our team can do for the community and what I could do for the community and how I could serve. I'm so grateful. Thank you.
All right, Dallas, sign us out, buddy.
Sure thing. Again, Dr. Emily, thank you so much for that time today. And everybody, check her out, connect with her, and get the answers you need. But in the meantime, if you want to connect with us too at CrossFit Edwardsville, you guys know what to do. You can hit us up on all the socials at CrossFit Edwardsville. You can put that into ye old Google machine and read hundreds of 5-star reviews. When you are ready, though, go to CrossFitEdwardsville.com. And all you have to do is click that little button that says book a no sweat conversation. You know how to do that. But yeah, we'd love to see you in the community as well at CrossFit Edwardsville to connect you with Dr. Emily and with all the great people who are here in the Glen Ed community. Until next time, everybody, thank you so much and have a championship day.